Let's give them a big round of applause. Thank you.
Alright, so how's everyone doing tonight? Good? Excited? Alright. My name is Gabriel. I am the director and founder of West African Medical Missions. We're going to kind of give you a quick program overview of just like the background and what it is that we do. And then Nick's going to kind of talk about more of the personal, individual stuff that goes on.
Yeah, so as Gabe said, I'm Nick Sausen. I'm a second-year medical student here at the U, and I've had the distinct pleasure of working in Sierra Leone the past 2 summers with Gabe. And so you might ask, who are we working with? And so Gabe, who are we working with?
Yeah, so we're working with lots of students. The majority of the stuff that we do involves pairing students from the U.S. with students over in Sierra Leone, in West Africa, and kind of working through community empowerment to alleviate a lot of the barriers to health that are existent there. So that's the introduction part. This is all new. So Sierra Leone is located over there on the west coast of Africa. Beautiful place, surrounded by beaches, good waves, it's a good spot. The country history, there was a civil war there. It was for 11 years, and during that civil war, about 80 to 85% of the health infrastructure was destroyed. So what that means is there was no clinics, the hospitals are gone. The offices where the ministers are working at is destroyed. There's no roads getting anywhere. And so what that did is it created a huge burden on the health infrastructure there, because there were some problems before the war, but after the war, the health just dropped. Some background, under 5 mortality rate. What do we have it ranked here? 5th highest in the world. A lot of these figures are from 2009. So children over there are dying from malaria, pneumonia, diarrhea. A lot of these things are preventable with proper medication or just using bed nets for the malaria. There's also a huge maternal mortality rate, which is women dying during childbirth. Back in 2006 and 2007, it was around 1 in 4. So 1 in 4 of every woman going to give childbirth was dying in labor. And they were dying from hemorrhage and from infection. These are not like cutting edge things that we need high technology to go stop. These are things that takes education and just some preventative measures. So also besides maternal mortality, we have infectious disease, we have HIV is there. It's not as high of a rate as it is elsewhere in Africa, but it is still growing. We have Lassa fever, which is something that's in one of the lower districts we work in Kenema, which is a hemorrhagic fever. It's like a sister virus to the Ebola virus, so it's pretty wild and crazy. Then there's yellow fever. So there's all these like crazy, awesome infectious diseases that are going around. But yeah, so these are some of the kids that we're working with. Like as I said, we go in and we do community empowerment. What that means is that we go in and first we like reach out to the high school kids who are looking to be in, go into being nurses or doctors or what do you have, and we bring them into this program. And then we teach them. Then we put these students into organizations and clinics to start volunteering. And then we give them the tools to kind of go through and detach what they think the barriers to health are. So the process that goes along through is called Young Stars of Sierra Leone. But this is more of just saying what our agency is. We're a 501c3 nonprofit organization. So when you are going through us to get your plane tickets and paying your travel fees, it's all, you can put it off as a tax write-off through the tax exempt status. We work with the Ministry of Social Welfare in Sierra Leone, so that's who we're licensed under, because we aren't going through the Ministry of Health because we want to be teaching more and reaching more than health, because we have programs like Girls Club where we're reaching out to young girls and empowering them and showing them about what the right ways for going about being young women in West Africa are. And that's taught by more so women than me. But we've been invited to the Clinton Global Initiative in 2010, 2011, and 2012. So we've been getting recognition internationally for a lot of the work we're doing. And what else? And then we're registered student groups here. We aren't as well put together in the U.S. as you guys are, but trust us, in Africa we really know what we're doing. So, but we also have a student group in Maryland as well. We're starting to branch out because people who have been interacting with us over there are coming back and saying, wow, this is huge, I want to be part of it. International volunteers, we've had people with all sorts of backgrounds. We really reach out towards undergraduate students, because I started this organization 3 years ago, being an undergraduate, in your shoes, wanting to go to Africa and actually make a difference. I didn't want to just go there and do the superficial medical tourism volunteering. I wanted to go there and actually know that I was creating a difference by going there. And so we really reach out to undergraduates sitting in your position and put you in places where you're going to interact with global health in a way that you never expected, and it's going to kind of shape you into a global health leader, because we're going to put you in places where you're going to be interacting with and understanding a lot of these burdens of disease people are facing, and a lot of it you're going to learn is due to education. So it's pretty cool. Then we have graduate students who are going, we have nursing students, medical students, and we really put people in diverse teams to tackle a lot of these problems. So it's great.
So here you can see I am working with one of our local senior scholars that we've worked with the past several years. In the middle, I'm Jada. And so he had taken on the role of becoming a teacher, that I worked with him really extensively, and so he did an awesome job really connecting on a local level with the students and being able to integrate that cultural sensitivity. And not that I'm culturally insensitive, but there are barriers and norms that I will never understand, no matter how many times I go there, and making references that students understand better. And then on the left is one of the top students from that class, Bio, and so it was awesome to have this exchange, this dialogue, to work with them to find out what are the barriers to health, how can we address those, how can I share the skills I have with you, and how can we work together out in the community of Sierra Leone.
Yeah, we have local staff, so we actually, West African Medical Missions is its own entity in Sierra Leone. We've created their own board of directors there, because we think it's really important too that we aren't just like a group of students going over there and helping them for the 3 months of summer, but that work is continuing on during that whole time, and they're actually directing everything we do. So on our staff we have someone who's one of the pediatric directors for the National HIV/AIDS Control Program. We have people on there who are student teachers. We have volunteer students like people yourself. So we really try and keep it diverse because we really want it to be an organization that's built out of the people there, not just something that we're creating and putting on them. So this is the Young Scholars of Sierra Leone slide. We call it Students a Day, Teaching Leaders of Tomorrow. We use these 3 different teaching approaches to teach high school students over the summer about the endemic diseases in their area. Then the last 2 weeks they go out and they do a community outreach, and that's based on doing research in the community. So they go out and they research what diseases are the burden in their areas. They come back, they develop an outreach plan, they present it, and then they go out and do it. And this is a map of Freetown, and those trees are all the different outreach spots that the students made outreaches for and are actively working towards right now.
So here we can see some of the students working on those outreach projects. That we work with them and develop their ideas, and they bounce back things and say, oh Nick, that's not going to work, or oh this sounds great. And we build that, and in that first picture we saw them out in the community, going door to door, that was a malaria outreach. And so here we're planning the attack of, how are we going to spread the message? What do we want to share? Are people going to understand those things? And so, as you might guess, the reason we're here is that we are recruiting. We're looking for people to come with us. We want you guys to make the difference with us in Sierra Leone, to help people of Sierra Leone know what you know, and for you to gain the opportunity to learn about what life is like in West Africa. And so we're looking for different people to fill different roles. We're looking for team leaders that would serve in a longer period, and it would also have more responsibility in that setting, that you would be there a little earlier, and potentially after a team would come in to work with you. And you'd be working very closely with those senior scholars, the students that we showed, that they would be your eyes and ears. They would say, Sarah, Joe, Amanda, we're going to go out and we think this area, Sammytown, they've got high maternal mortality rate. Let's see if we can address something, an educational program, or if we can do some research in that area to figure out some of the roots of that problem. And so as a team leader, you would filter that in and you would build a project for your team. And then also there's people that fulfill those team roles, and they would be there for a shorter period. And we're looking at having 2 parts of the summer. So either you can come in the early part of the summer or the latter part of the summer. And as Gabriel was saying, Sierra Leone is an absolutely beautiful country. I've seen some of the most beautiful beaches in my life there. I've gotten to trek through the jungle, and I've had a great time learning about myself and about a new culture. And so these are, you can read about this in your handout, but we're going to be working in about 5 different spots this year. Freetown, the capital. Kenema, where we were last year, is a beautiful city that is based in the Kenema district and has the world's only Lassa fever hospital, so we were able to work with doctors who are investigating this hemorrhagic fever. And then some new sites